I want to thank everyone for being here today. It's unfortunate we're going to be here speaking today. We've had our first death of COVID-19 here in the state of Missouri. It occurred in the Columbia area, and I am going to let the mayor come down just shortly, just a little bit ago, to give me a briefing on what had occurred. But this will be the first recorded death from the COVID-19 virus. And I'm now going to turn it over to the mayor of Columbia. Mayor.
Thank you, Governor. Thank you, Governor. Good afternoon. Today, the Columbia Boone County Public Health and Human Services Department was notified that the patient who tested positive yesterday for a travel-related case of coronavirus, COVID-19, has died. This morning, the family of the patient placed a 911 call to report a medical emergency. Boone County emergency communications operators were told that the patient had tested positive for COVID-19. Emergency responders were operating under the Pandemic Disease Operations Plan, and they wore the proper personal protective equipment, PPE, before entering the home and making contact with the patient. The patient was transported to University Hospital at MU Healthcare. Emergency responders were first isolated at University Hospital under medical supervision and were screened for exposure protocol and potential testing. And until additional guidance is received, these 6 emergency responders are being quarantined in Boone County. Public Health and Human Services made notification to the Missouri Department of Health and Senior Services as required, and will continue to work with the family to trace and evaluate exposure risks. We mourn the loss of one of our community members, and I thank our healthcare providers and first responders who had planned for this, to be prepared but not panicked. We are in this together, and we will get through this together. I now want to introduce Dr. Steven Wit with MU Healthcare to provide additional information.
My name is Dr. Steven Wit. I'm the Chief Clinical Officer at MU Healthcare, also an infectious diseases specialist and critical care medicine specialist. The information relayed by the Governor and the Mayor about a death at MU Healthcare this morning is correct. I would like to take the opportunity to tell you that our systems worked well. Our teams were prepared. There was no panic. Our communications with EMS were excellent. Unfortunately, we had a bad outcome, which raises anxiety, which gives me an opportunity to tell our audience that this is serious. We thank our public health officials for doing things that at first may seem onerous, like avoiding church, avoiding schools, avoiding university classes, avoiding public places. But this is reinforcement that COVID-19 is really here, and we really need to do our part in taking care of our sick and needy people. Thank you.